Now let's get started with Kim Broom, FHCA's Director of Clinical and Regulatory Services, who's going to moderate our first panel. Please welcome Kim to the stage.
Thank you, Emmett. Our first topic this morning is on caring for nursing center residents during a natural disaster. I'd like to introduce our panelists. We have Robin Blyer with RV Health Partners, Susan Conley with Canterbury Tower, Kip Corveau with Bon Secours Maria Manor Nursing Care Center, and Paul Womble with the Florida Emergency Preparedness Association. Thank you. Tell us about a typical resident that you care for in your centers.
Thank you, Kim. Well, you know, it's interesting. Through the years, residents have changed, haven't they? So now when we look at residents that come in, there's really two primary groups, and there's a little subdivision. There's the post-acute rehab resident, right, that comes in, that after they've had surgery, accidents, and so forth, and they're coming in for post-acute rehab, skilled nursing, skilled rehabilitative care, and the hopes of going back home. And they have a lot of clinical complexities. We then have the long-term care resident, and they're kind of subdivided into two divisions. One is the resident has Alzheimer's or cognitive deficits, dementia, and other types of issues, and they're long-term and they're not going to be leaving. And then within that, we also have another group that might be younger, developmentally disabled, sometimes very alert and oriented residents, but because of all their physical maladies, they're not able to go. The residents in our facilities are clinically complex. They have multiple comorbidities. They have a lot of risk factors. They're advanced age. It's not uncommon to see residents in their late 90s. I worked with a facility during the last event at Irma where they had the average age was 93 of that facility. They had a 104-year-old. They had a 100-year-old. They had a 98-year-old. It certainly speaks to the great care that everyone gives to their residents. So there are really a lot of complexities that come with that. When you look at people, there's intravenous feeding in the facilities, total parental nutrition, ileostomies, colostomies, jejustomies. We look at people having enteral feeding tubes, suctioning, ventilator patients, people who have sleep apnea and they need to be on a CPAP machine. Often they have continuous oxygen. So we look at people that are on often more than 12 or more meds in a day, people who are often on insulin-dependent diabetics, people with a variety of issues that make them very complex, and it's not just one or two issues, it's usually 6 or more.
Okay. All right, so in the off season, when it's not hurricane season, what do you do to prepare for a storm?
So one of the things that we do is we are constantly preparing for a storm. And so when we intake a resident, we talk to the family or we talk to the resident themselves, that's the first conversation we have when we're doing intake, is what are your evacuation plans in case of a hurricane, in case of a disaster? So we begin the conversation with the residents and the families immediately upon admission to the facility. And that conversation continues through their stay with us. As the storm approached, for example, we reached out to every single resident family member to confirm their plans for their loved ones that we were caring for, to make sure that we understood and they understood what was in the best interest of those residents. And so we educate our families at our family council as part of our yearly process before the season hits. And then with our staff, we have continual staff education. We are constantly talking to them about disasters, about what our plan is, drilling them, training them. 100% of our staff need to be compliant and understand what our disaster plan is and what we're going to do in a disaster. And we do tabletop exercises. We work with community coalitions that work on disasters. So this kind of planning is not something that happens 20 days out. This is a constant state of awareness for us, off-season and in-season. And in the off-season, we're working on contracts with vendors to make sure that we have portable generators, to make sure that we have fuel, to make sure that we have other kinds of necessities that we're going to need in case a disaster happens. So it really is for us a continual mindset, because we feel the weight of the responsibility to care for those who have been entrusted to us by their families. And we feel that everything within our power is what we need to do to plan and to make sure that we're ready in case something happens.
So, first, thank you for the opportunity to be here. The emergency management community in the state of Florida, county level, we're tasked with reviewing facility emergency management plans. So that's part of it, but preparedness is the key. You're absolutely right. There's plenty of opportunity in blue sky days before a storm to do these activities, to quite frankly take the planning process seriously. Recently, the new thing is that the healthcare coalitions, I can tell you in my county, the turnout and participation from all of our medical facilities is fairly low. So that's one thing that can be done, is get engaged. You need to build those relationships now. You don't want to wait until the hurricane is here to figure out how an EOC works, that you figured out your vendor's not going to fulfill their contractual obligations, or that your plan doesn't work. Testing those plans, developing those plans, exercising those plans, that's a process. It's not a one-time shot. So at the local level, facilities need to get to know their emergency management staff that review those plans, get engaged in those coalitions, take the exercises seriously. Don't just do enough to get a ticket punched. Really learn from it and apply those lessons to make the facility safer for the residents.
Thank you.
So I would just add is our organization felt that it was serious enough that we engaged outside consultants to review our plan to make sure that we were not missing anything in our preparations. And we have still engaged those consultants to help us learn the lessons from having to evacuate and what things we can do better next time, what lessons learned down to the level of our frontline staff to allow them to have input in our future plans going forward.
I just want to ask, how often are the EOC plans reviewed? Is it an annual thing?
They have to be reviewed either upon initial licensure or annually. So for us, we have about 100 facilities. Some counties have, Miami-Dade has over 1,400 facilities. So it's a process. Again, getting to know the folks that do those plan reviews, understanding the formats, the requirements. Because we get a lot of technical questions that if you have that relationship, you can work those out before the disaster strikes. It's not just hurricane. We had a facility recently that had a internal plumbing issue, on a Saturday afternoon on a blue sky day, and they had challenges with their transportation provider, for example. So we were able to help facilitate that, but hurricane obviously is our focus now, but it could be a no-notice type event where the rest of the community is doing their normal thing. It's not a statewide issue like we've had here, so that should be part of the perspective.
Okay, thank you. So how does the lack of power impact your residents?
Good morning. In many ways, I feel like we're probably preaching to the choir here, but and I echo what Kip and Paul are saying about planning and preparing all year long. When we hire staff, everyone understands that what it's going to take in the event of a hurricane or a disaster. In terms of lack of power, absolutely, it's going to significantly affect our residents. The first thing that we're looking at is then those residents that are dependent on oxygen and what are their needs. And we have already oxygen supply, the emergency cylinders safely stored in a facility. We're looking at ventilation to keep the residents from overheating, obviously fluids to prevent dehydration. This takes all departments. It's all hands on deck. Again, the preparation all year long to make sure the staff understands their involvement. The lack of power, affects the lighting, so that environment changes your residents we have residents that have dementia and cognitive impairment. So the staff, we have a lot of longevity in our facility, so we're like a family, and so the residents, they stay calm, but that's a lot of efforts from the staff to help that situation and try to provide as much normalcy as possible in keeping the residents comfortable and calm and in place. Of course, we're still looking at nutrition and the needs of the residents constantly. The other thing that we have to think about is the residents that are total lift, because we use a lot of the mechanical lifts. It's safer for the residents, safer for the staff. But what happens when you don't have power? Do you have your batteries? Are they charged? Do you have enough battery to manage those lifts in the case of that? We, at our facility, purchased years ago a mechanical lift that does not require battery or electrical power, and that's been very helpful. Whether you stay in place or whether you evacuate. And if you evacuate and you have your residents on a mattress within a low position, that's very, very helpful for everybody. But it's definitely a challenge, but we plan all year long. We train all year long, and it's not something, the positive thing about a hurricane is you know it's coming, you don't know where it's coming, but you start preparing, you don't wait. And I think everyone's committed to that facility for sure.
Thank you. Okay, so what would you do to keep your residents safe when the power went out and you had 75-mile-an-hour winds whirling around?
So that one's mine, and I would divide it into two things. One would be, did I know the 75-mile-an-hour winds were coming, in which case I'd probably have removed everyone from the room, shut the doors, put people in hallways or other areas without being near the glass. I would have done a lot of planning with my staff in a proactive way, as Paul and Kip discussed with regard to staff training. And then reactively, we would want to make sure that we were going to keep them calm. The sound of wind, depending on your building, can be very frightening to residents, particularly in the higher story buildings. So Susan's in a multi-story building, for instance, and the sound of wind is very frightening. So in the past, we've actually played music to kind of soften the sound of the winds and so forth. We've also been really good about preemptively telling people, this is what we're going to hear. We're going to have a storm. It's really possible that we're going to hear the wind. One of the nursing assistants described it to one of the residents as, she said, Jesus was singing to everybody. And it seemed to give the residents peace, so okay. But sometimes you don't have time, and sometimes you're more reactive. You may have, we had in Hurricane Charlie, for instance, really everyone thought Tampa Bay, Tampa Bay, Tampa Bay, and then Southwest Florida unfortunately got smacked. And so they didn't have a lot of time. So the less time you have, it's the importance of all those drills that you talked about, Kip, that you do with your staff is so important to make sure that everyone knows how to react immediately, how to pull people out of harm's way, how to get them away from windows, how to make sure that we congregate people together, how we keep them safe and comfortable. And I think the most important part about how to keep people safe about that is what we're going to do now, all the after-action work that everyone's going to do. Because we all learned a lot, but if we don't talk about it and we don't work on it and we don't train it and we don't add it into our planning, we're not going to gain from what we learned. And I'm sure Paul would speak to that, based on working with FIPA.
Yeah, that's an important part of the cycle that I mentioned. You have an event or an exercise, you learn from it. You don't just write a report. You should take that report and build on it. What did we learn? What can we do better? Training, funding obviously is a huge part of the issue that we have right now. It may not be things you can fix overnight, but you need to continually go back to those, review those lessons learned. That's part of the planning criteria that exists now, is to have in your emergency plans lessons learned. So every facility in this state should be updating their plans based off of what they learned in Irma.
Correct. Good, thank you. So how did the local EOCs and the nursing homes collaborate together prior to the storm, during the storm, and after the storm?
So I mentioned some of the before already, healthcare coalitions in each community. Those look a little bit different in around the state. There's either a local agents coalition, a regional coalition, but either through your county emergency management agency or the planners in the Department of Health in each county. If you're not hooked up, they can make that connection for you. That's a big thing. We have a monthly meeting outside of our coalition, our Emergency Preparedness Advisory Council. That's been in existence for close to 2 decades, city, county, state. hospitals, medical facilities, volunteer nonprofit, and it's to bring together the folks from all levels and we have a fairly broad emergency management agenda where we talk about things, impacts, trends, training opportunities, exercise opportunities. The key to emergency management and being successful is relationships. You don't want to wait until 2 o'clock in the morning on a dark and stormy night to try to figure out what an agency does. How do you get a hold of them? Who's the contact person? Some of the realities that we see in a disaster. So again, preparedness, pre-storm, hurricane season in Florida is 6 months out of the year, and we should be preparing all year. During the storm, during the activation, especially when the winds are high, it's not safe for responders to go out in the field. We monitor the storm. We try to figure out impacts that are occurring or what could occur. At some point, emergency services stop responding. We had a healthcare facility that called the morning after the storm. It was still, in some parts of our county, the winds were high. It was not safe to send high-profile vehicles, and they had a fuel issue with a generator. So part of that is to understand, again, how those EOCs work. And just because you call does not mean that we can beam over resources right away. There's limits to that. We've mentioned a resource poor environment. What happened 2 weeks before Irma, Harvey in Texas, right? So a lot of resources were already deployed, generators, all those things. So we were challenged right off the bat. So again, relationships to understand how the EOC works. What are the limitations? We have 67 county EM programs of various sizes, complexities, and responsibilities tasked on them by what they do at the local level, all kinds of things we could talk about. So after the storm, we're after now. Again, get involved with the coalitions, get involved with your health department planners, get involved with your county emergency management agencies, and as we move forward, those relationships will just, those investment in that time pays off, and that's what we need to do.
So maybe just a couple little details of coordinating transportation, when you had the fuel issue, some of those things that you were participating in. Is that correct?
We had requests for some of those services. Those are all things that are required in your plans already. If it's a really bad day, we can help. But from the county perspective, we had lift stations without power. We had water plants without power. We had a very finite amount of fuel for first responders. So again, there's a large demand for resources in the first day or 2 or 3, as we heard, after the storm. And the counties, and the cities, the local governments, they don't have an unlimited amount of fuel, an unlimited amount of generators. Depending on school boards, local transit authorities, some of those kind of things. Again, there's not enough resources at the county level to help every facility that might call. So, again, go back to blue sky days. We need to have those plans, those agreements in place now before the storm.
Okay, so why would a nursing home be reluctant to evacuate the residents? What would be a reason?
So think about if you evacuated during the storm. Think about if you knew if someone evacuated the storm, a family member or a friend, and how incredibly stressful that was, that whole activity. So imagine yourself for a minute with physical challenges or cognitive challenges, leaving the only home that you've known for years upon a time and having to relocate to a strange place, lying on a mat on the floor where the care is given to you right there. So we were in a mandatory Zone A evacuation, and we had to evacuate 310 residents on school buses across the length of the city of St. Petersburg. And so the challenge that is involved in that level of activity and the trauma, both psychic and sort of physical, on the residents is immense. So really everything that we have done in sort of preparation is to try to stay in the surroundings that the residents know, are familiar with. because it is a huge trauma to move people like that in a hurry, even in a blue sky kind of day before the storm hits. And so really all of our planning and our preparation is to try to remain, but sometimes that's not within our power. And so part of our planning is, what do we do if we have to evacuate? And how do we make things as normal as possible for our residents, so they're able to get breakfast as they like it, or coffee the way that they prefer it. But it is a huge trauma for our folks to be able to be forced to relocate, to evacuate in a storm. And so we really do everything within our power humanly possible to prevent that from happening, but sometimes it's not within our power.
Anybody else?
Well, I would echo that. We certainly don't want to have to move our residents, and exactly what Kip is saying. It's very traumatic, and even in the best circumstances, moving the residents is, really the last thing you want to do. But of course, we don't want them to be in harm's way, so we're prepared to go once we see the hurricanes heading our way or we see a disaster. But keeping things normal, keeping the residents calm, keeping the families, they have my cell phone, we had someone stationed, and we are also a level A, and so we had to evacuate our entire building. And it's a lot of work, it's a lot of effort by everybody, it's a lot of staff, it's all hands on deck, everybody knows that, and it's difficult. It's difficult for the residents. And you work together with your receiving facility, not just at the beginning of the storm, but throughout the year. And of course, we called our receiving facility to see if, I called and said, you are staying, right? Are you leaving? So you have to plan on that. It is interesting when you get down to some of the things that are already discussed, transport and the contracts that you have. Things get to waffle a little bit, so you have to start thinking, how can we do this independently if we have to? And that certainly was, even though we had a contract and a good relationship, things change a little bit when the storm's coming. So all of those things have to be taken into consideration, and the relationships and resources that you have to be solid. And we had a lot of help from Florida Healthcare and Leading Age, and it's tremendous.
Okay. Any questions from the audience? Okay. I just want to say, we have a question. Do you include the staff in their plans to ensure they can serve their families and their pets? And do your staffs plan for families too?
Well, I can help answer that question. We talk about it, immediately upon hire. When we hire someone, they understand that where we're located, and it's a real possibility. So we want the staff to have a plan themselves. We'll help you with a plan. Try to have a plan, because it's not always possible for them to be with their children if they have small children, or sometimes they have special needs family members of their own. So they need to have a plan. Pets, I have a pet. I take my pet to work, but my pet couldn't go with me. I have a plan for my pet. So I always tell them, try to have a plan for your pet. At the last minute, we're always going to have someone that's going to have, and we're a family, so we're going to help each other in however we can. So we definitely, it's just a lot of communication, a lot of dialogue about what's going on, what are your needs. And as long as we know, we can plan for that. And we certainly aren't going to leave anybody in the cold.
So we divide all of our employees into an A team and a B team. And the A team is the folks that actually deploy with the residents if we have to evacuate or shelter in place. So we figure out before the storm hits if they're bringing family, if they're bringing pets, what are their other kind of needs, because we need the staff to care for the residents. So one of the things that we have to do is we have to shelter our employees' families. They may be in a Zone A evacuation. They may be in a mobile home park or some other kind of place. So that's already part of the plan, and that entire list is created long before the event happens, so that we know that who we can count on, who's going to be there for the disaster.
Okay, thank you. Okay, the next question is, what kind of expectations, rules, et cetera, are we planning on local emergency management to prioritize SNFs in an emergency in the same level as hospitals and not equal to residents or doctor's offices? Even if local resources are limited, our priority to receive those resources should be higher. Maybe, Paul, would you like to address that?
So your plans, again, your plan should be based off your threat, your hazards analysis. If you're a coastal county and you're in an evacuation zone, your plan should have, if we have to evacuate and we based off your facility and beds, number of folks in your facility, how are we gonna do that? When the EOC, if we're activated in the time after the winds have just left, we're getting requests from all over, from cities, local governments, water plant operators, all those kind of folks for generators, fuel, all those resources. The process in Florida is you look for your resource first internally. You can't find it, then you can go to the county EOC, and we may have an agency. We may be aware of a supplier of a resource. That could be a school board, a county agency. Generators were the big one. In our county, we do not have an inventory of generators to meet our own needs. We asked for over 50 generators after Irma to power for cities, for counties. If we can't find it within the county, that goes to the State Emergency Operations Center here in Tallahassee and working through state and federal plans. And a lot of those plans go back to contracted vendors that have, especially if you're talking about generators. So, and it takes time. We'll get a common request is, I need a generator. Okay, how big? Big. We have to have specs. And a lot of that pre-planning should be done. I mean, you're getting ready to have to go through that now to determine the generator size that meets your facility's needs based on these new rules. So when you call up at 2 in the morning on a dark and stormy night saying, I need a generator, and the people don't know, we can't even begin to start trying to find a source if you don't know what you need. So that's got to be a priority in this process.
Okay.
So, but as far as priorities, again, there's limited resources with wastewater, water, all those things that local government has to do. Certainly the medical facilities, nursing homes, hospitals, et cetera. We understand that, but the bottom line is there's not enough resources for everybody, and that's why, again, I'll go back to the importance of planning and not dependent on contracts. We're seeing that in various things now. It's been mentioned here. Just because you have a contract for something, that doesn't mean that something's going to show up.
Okay, thank you. So how do you plan for dialysis patients when you shelter in place or evacuate?
I worked at Pinellas County EOC for Irma, so I was watching how the county dealt with that in Pinellas County, and they did a great job. There was a lot of pre-storm dialysis treatment. There was a lot of work with the nephrologist to come up with some protocols for residents to help decrease their need to let them go in a couple extra days with dialysis, but it's a really big threat. One of the things that got brought up earlier that really is key now is we had a facility that came to Palm Harbor from Naples. And the reason why they left from Naples was because they had a big threat, but then they came to Palm Harbor, and they went to a building that went 4 days. 2 of the people that got there had, on the 9th, we were being challenged with they needed dialysis. They hadn't had it since the 5th and the 6th, and then 2 more, the 7th, and this was already the 9th, knowing that we're going into the storm and that we're lucky if the dialysis centers open up on Tuesday. So there were some nutritional things that could be done. We worked with dietitians. Also, we could work with making sure that those that were the most at risk, the facilities did good. They had some nurse practitioners that were seeing them. There are certain medications that you can give that help to bind with ammonia and remove that from the body. So there were different steps that could be done, and that's how they handled it this time.
Okay, good. Anything else, Susan?
No, we don't currently have dialysis patients,
Okay.
but I can echo what she's saying.
All right, thank you. So this is addressed specifically to Paul. What considerations are in process with vendors not to overcommit to support more facilities than their capabilities, emergency water, fuel, etc.?
I can speak specifically to your transportation agreements of all the facilities that we review their plans each year. It's the same 2 or 3 contract bus transportation providers. Again, that's great if it's a single, so that's one of the issues with the planning criteria. It's based on a per facility impact. It's certainly not the worst case statewide impact that we saw in Irma. So I'll say again, just because you've got a contract for a resource, there's no guarantee that you're gonna get it. So I would be asking the contractors, who else do you do business with? And when they say, gee, we've got 100 or 200 or however many other contracts, that would give you some reality about where you might fall in their capabilities to deliver your resource.
Okay, so to address this question specifically, are there any specific considerations that you're aware of to help this not, that you know of? Maybe is there some type of like boundary, or it's just what it is?
That needs to be part of the way forward after today is to do an assessment. I'm not sure the answer is, but the reality is
Nothing in place right now?
no.
Right, okay. That
Yeah.
answers- Yes?
I'd just like to say that when we reached out to our transportation company, we were told, well, we need to wait until EOC gives us direction. And that was a little confusing to me. So I tried to get some answers on that, but hopefully we'll get further into that. But that was
Those
interesting.
were people that you'd contracted with and already had an agreement?
And this was well before the mandatory, evacuation was put in place in at least our area.
Okay, all right. So are there intake scripts at the EOC to, I can't read this completely, sorry, identify needs or training and for an assessment for the residents to update for their environmental status and form to intake mutually use like an adverse reporting, like you would do with adverse reporting? So I guess this is saying if there's something that goes wrong, do you have intake at the EOC for their medical needs, and then if something changes for their status?
At the EOC that I worked at, they certainly were interested in such situations, but if somebody had an actual reportable event that would be under our normal requirements of reporting, to the best of my knowledge, none of that was suspended, and you would complete the normal reporting process. If it happened related to the emergency situation, if it was involved in using an asset that was delivered to you perhaps by the EOC, there might be an incident or accident report that the EOC would want to do. Paul, I would believe that to be true.
Well, again, we look at the county level. We're looking kind of at what we call the 30,000-foot view. What's the high level of the impacts in our counties? So certainly impact to the healthcare system as a whole is a part of that. That starts with hospitals, and then nursing homes. That level of care, but we don't really get down in the weeds, particularly certainly not within the first couple of days. But and those are some of the things that get reported up to the state. I know that the state just switched their system from one web-based system to another. I've talked to several folks that other county EOC directors that at some point they were having to call facilities either because facilities couldn't update, they weren't update for whatever reason. So the EOC is typically through the Emergency Support Function 8 desk, which is typically led by county health department. They were having to call all the facilities to even find out what their statuses were.
Okay, thank you. So this is addressed to Paul. Paul, are you aware of any current training used in the nursing home incident command system to better manage the unplanned emergency?
The incident command system is a management methodology. It's been a mandate from DHS and FEMA since after September 11th. In the healthcare world, there's hospital incident command training. I know that the Florida Healthcare Association and our association, FEPA, we've offered that training at several times at several venues for the last several years around the state. And that's training is certainly a big piece that these local healthcare coalitions can help not only facilitate with some of the funding, but there's lots of capability, lots of talent at the local level to teach these classes. So it's absolutely out there, has been for quite some time. Folks just need to seek that training out and attend.
Okay, thank you. So another question is, did you have any issues with staff abandonment? Were where they evacuated and failed to perform their duties. What strategies did you use or suggest to deal with this issue?
In the county I worked in, there's 77 nursing homes, there's over 300 assisted livings, and there's, I think, around 30 hospitals. And to the best of our knowledge, there was no facility that happened to. There was an independent living facility that's not a licensed entity that did have an issue, and Publix came and fed them. And the county was aware of it, and the support was provided. But I was very proud that that didn't happen. But what did happen is that in certain cases, some people that were on like the B team couldn't get to the building. And what a lot of smart providers told me that they did was they issued letters on their stationary letterhead calling their staff essential healthcare workers and making sure that they had their ID so that if there was a police block, they were able to show their credentials and their identification so that they could get to work. I only heard of one particular facility that had a problem, and what we did at the emergency operations centers, we went over to law enforcement and they were able to radio out to that particular location, and that issue was resolved immediately.
Okay, thank you. Okay, so do any panelists have a generator to meet the governor's order as of now?
So we have a generator for our skilled nursing facility that powers the entire building.
Including the air?
So including air, and we did that in 2011 because we thought that was an essential requirement to care for our residents.
Thank you. So this is to Paul. Many communities, are vacated due to their geographic location and flood zone. Has any consideration been given to allow elevation, wind, and generator-equipped buildings to remain? Hardened, I'm not sure. Okay, so has any consideration been given to allow elevated wind, hardened generator-equipped buildings to remain?
So mitigation actions are the things we do to reduce the impacts of disaster before they occur. Wind mitigation can be shutters, impact-resistant glass, doors, openings, etc. Flood is tough because not only can you have impacts directly, we've all seen stories from post-Katrina of generators that were in basements, first floors, they got flooded. So some of those, I'm aware of some of those activities have occurred. The facility itself in an evacuation or certainly a storm surge zone. If you'd like me to name the name, I can, but I know there's a very large hospital in the Tampa Bay area that sits on an island, and their plan is to evacuate up. I don't know how much it's cost, how intensive their mitigation activities have been to reach that status. But are there plans for a vertical evacuation? Sure. Again, that goes back to some local conversations with permitting, regulatory agencies, all those kind of folks that should happen at the local level to work out those details.
Okay. All right, thank you. So question to Paul, you're it. Are operators trained on how to assess the urgency? Some do not know what it is meant by submitting a mission. Can we develop a mission intake tool to help triage the urgency of needs? Has anything like that been discussed or potentially in the works?
The question included mission, so that sounds like to me that someone's had the experience of talking to the local EOC to request a resource. So we all have a mission management process, whether it's for people, commodities, equipment, whatever it might be. And I described that earlier. You look first, whether that's a city, your own entity, whatever your case may be. If you can't find it locally through any way to get a resource that we have, the next step is to come to the county EOC. We take those requests, we look internally within the county, and if we can't fill it within the county, then it goes to the state. The last I checked yesterday in the state's mission management system, there were almost 7,000 resource requests. I don't have stats of what those things were, but I can assure you when there's that many requests, certainly triage and prioritizing happens, but again, when there's not enough resources to meet the demands, there's no way just to beam those resources over. It's not a quick process. We asked for a very large generator, a 2,000 kW, which is a semi-sized generator, and the necessary hardware and electricians and support staff to go with that for one of our, a cancer treatment facility in our county. And from the time we put that request in, the last we checked, it took somewhere around 3 to 4 days for that process to get there, and by then the power had been restored. So it's not a fast process. You know, I think there's some misunderstanding that you can just call up your county EOC and we're going to rapidly send over generators or people or fuel, and that's not the case.
Thank you. So Kip, this is addressed to you. Is the generator that you have diesel or natural gas?
I'm looking at my subject matter expert who's sitting at the table here. Diesel. So it's a diesel generator.
Okay, thank you. And then Paul, what considerations are being made to the state level to better coordinate local EMAs to coordinate school systems, buses, resources, so to efficiently work together on a local level during emergencies and not rely so much on private vendors?
I'd go back to the strength of relationships at the local level and doing some reality checking of how many resources you plan to get from a contracted provider, and taking a look to find out how taxed are they, and then go from there on some plans. You know, through our association and many others, you know, there's a very strong emergency management community. That's not just the counties. That's cities, state agencies, through venues like the Governor's Hurricane Conference, through the FIFA annual meeting, activities put on by the Florida Division of Emergency Management and others. There's plenty of opportunity throughout the year, all around the state, for healthcare facilities to get involved, and they just need to do that, get engaged. You don't want to wait, and again, 2 in the morning on a dark and stormy night is not the time to get engaged. That needs to happen today.
Right. Okay. Any last comments, Robin?
I would just like to say, you know, our November 15th emergency preparedness rule and our rules of participation rule has quite a few risk assessments and other opportunities for us to really self-assess, self-identify, look for our gaps, and with that, you know, work with our emergency professionals, Paul and you know, Eve and the rest of the folks at our county and with the associations to help us to make our successful strategies. We're all going to have to do it together.